Hi Dr. Nisha, my friend is being treated for a breast cancer. What is the accelerated partial breast irradiation?
As already discussed in my previous videos, radiotherapy is an important treatment a lady has to undergo after the breast conservation surgery. Usual number of sittings is anywhere from 15 to 25 with or without another 5 to 7 sittings of boost. Accelerated partial breast irradiation or apbi refers to the use of a focused and higher dose of radiotherapy to a limited portion of breast delivered over 1 to 5 days. No doubt, it is a more convenient alternative, but only a very small section of patients qualify for this treatment. Usually, they are more than 50 years of age, has a small, that is less than 2 cm, node negative breast cancer with a good surgery with sufficient removal of the tumor, and a rim of healthy margin is also removed. Now, how do we deliver apbi? There are multiple ways to deliver this fast and condensed form of radiotherapy. One is brachytherapy, wherein we place radioactive material into the tumor bed, that is the area in the breast out of which the tumor has been removed. Other technique is intraoperative radiotherapy, whereby the entire dose is given in one sitting just after the surgery in the operation theatre itself. And of course, there is external beam radiation therapy, which is delivered using a linear accelerator, which is non-invasive and uses either a three-dimensional conformal radiotherapy or an intensity modulated radiotherapy to deliver focused beams of radiation that follow the exact contours of the intended area of treatment. Higher radiation doses can be used because the damage to the surrounding tissue is limited, possibly resulting in more effective treatment. Treatment is usually completed in 5 to 10 sittings. Brachytherapy involves the temporary placement of radioactive material into the bed of the tumor using hollow catheters, either in the form of hollow tubes or balloon-like devices, and the placement of these can happen during the surgery itself or after a few days of surgery. Once a catheter is placed and secured, a CT scan is done on which the calculations are performed. The catheters are then connected to a brachytherapy machine which sends radioactive materials into them in such a way that the intended area gets the intended amount of dose, and this without causing any damage to the nearby areas. Treatment usually is delivered in 10 sittings over 5 days. A possible side effect is the mild risk of infection and poor cosmesis with a small possibility of scarring due to multiple catheters. In intraoperative radiation therapy, the entire dose is delivered in a single fraction in the operation theatre itself just after the surgeon removes a tumor using a portable radiation generating device, thus concluding the surgery and radiation in just one day. In a nutshell, accelerated partial breast irradiation is a convenient, safe and feasible technique that cuts down the treatment by several days. When patients are selected carefully, it yields a result that is equivalent to the long course radiotherapy with minimal side effects. The content of this video is just to guide and educate, and obviously the final decision is to be made after a detailed discussion between the patient, the family and the treating team.